Parents getting frustrated, my hope is they're listening to this going, wait, I need to step back and figure it out. And SM being an anxiety disorder, talk to me about the anxiety connection, because I can imagine this causes avoidance
Yeah.
and causes heightened anxiety. And so much of our life, look, SM is a social communication anxiety. Having misophonia
Yeah.
affects your ability to socialize. Everything we do is in places with sounds, and many of which you
Yeah.
shared: chewing, crunching sounds, repetitive noise, clicking of pens, tapping
Yes.
of a foot, breathing, sniffing. These are social stuff.
Yeah, they're social stuff, they're everyday things. And yeah, so there's a strong anxiety connection here. A patient of mine very well described it to me, where he said, imagine that you are in the reading room of a grand library. And this is it's almost like a this person is a writer, so you can see where they're going here for their love of written word. But they said, imagine you're in this grand library, a temple to literature, and there's just one rule here, and that is that when you're in this reading room, you're not supposed to make any sounds. You're supposed to be quiet, and you're just supposed to read. Now imagine you're there and you're reading something you love and enjoy, and there's somebody right across from you that is making a very loud sound. They're tapping, and they're tapping, and it's distracting and disorienting. And imagine the frustration you would experience at hearing this, and also imagine the frustration when everyone else is just ignoring this. And you want to say, "Look, this person is breaking the rules. They're not staying quiet. Aren't you all distracted, disgusted by what is happening here? Isn't someone going to do something about this?" So you have the anger, frustration of the sound, and then you have the anger and frustration that nobody else realizes this, nobody sees it, nobody's doing anything about it, which makes you feel so much more enraged, frustrated, invalidated, alone, isolated. So that's kind of what this experience is like. And the way it connects to anxiety is any situation where you know reliably these sounds might be occurring, you, you are on guard.
So no, that's a great example, and I, of course, with my, attention towards SM and hyper focus on that, I think to myself, conversations, the child is mute, the teen is mute in a social situation. Well, it's similar, like they can't have the conversation. If you have misophonia, you're so busy trying to just process that noise. Like you said, you've got all of those thoughts going through your head. How can you have a conversation? Hi, how are you? Good, how are you? What are you doing this weekend? You can't do that. You can't engage in a debate in class. You can't answer the teacher because the kid next to you might be tapping or breathing, which most do. And so the whole premise of why is social communication so difficult in someone with SM, that why of SM, because I'm always about what is the factors into the development and maintenance of it, having misophonia alone is a reason not to be able to communicate effectively if those sounds are bothering you in all of these social situations, in school, with peers, with teachers, at a restaurant, at a store, at a birthday party, at soccer, at gymnastics, even in a small play date situation at home. If these sounds, how can you build social communication skills, and how can you build peer relationships well if the everyday sounds or specific sounds that bother that child are involved with those kids that they're trying to be friends with? How do you deal with that?
Yeah, absolutely. And it's very, very difficult, especially as a therapist or as a parent or as a teacher, to try to understand what's going on here, because there are so many reasons why a child might not be communicating. And sometimes it's anxiety, sometimes it's disgust, sometimes it's not knowing what to say. There's so many reasons why a child might look frozen. And misophonia can definitely be one of those things. I can give a personal experience. It's funny how life kind of works out
Yeah.
sometimes. I spent a long time treating this problem, and it was with some detachment from it, and which is different than, like, I was definitely a selectively mute kid. I've always had an interest in anxiety. I
Wait,
had
you had
social anxiety.
selective
That
mutism?
was Oh yeah.
Wait, how come I didn't
Yeah,
know
yeah,
that?
yeah, yeah. This is why I got your email. I was like, absolutely, yes,
Oh
I'm gonna say yes
my
to
gosh.
this show.
You know what?
Absolutely.
Maybe
Yeah.
you told that to Brandon, but I didn't know that. I'm like, and listen to how outspoken you are, right?
Well, it's a journey, right? It's so I was a kid who if I was outside my home, I just did not speak. And this persisted from kindergarten to second grade, and then it started to evolve into more social anxiety. But what happened for me is I learned really early on that if I didn't speak, someone else would speak up for me. And and that was great until it wasn't. And and so social anxiety and anxiety and selective mutism, these are things that have always been very near
I
and
knew
dear to my
social
heart.
anxiety was, and that was one of the things that attracted us
Yeah.
to you. But the SM piece of that, I mean, I'm really excited to talk with you because I feel like we could talk forever because I feel like when
We
I
could
talk to
do
professionals about SM in general, so few really see it from the perspective of SM is a social communication anxiety. And you have to see it from that perspective rather than treat to speak. Because that philosophy, if the child or a teen or whomever isn't in that place, all you're doing is reinforcing anxiety and avoidance. And it's just like what you're describing, like that sense of shame. And so it's how do you teach parents and all of that. That's why for us, so much of what we do is parent education. I mean, our camps are all day. The kids go to camp at Communicamp and the parents go to camp at Communicamp.
The thing that really frustrated me, Dr. E, is that I didn't even understand that I had selective mutism until I was in graduate school treating it. We had a behavior therapy center in Washington, D.C., where I was going to grad school. I was working with a group of mostly selectively mute kids, and my supervisor was explaining to me what selective mutism was when we first started getting ready for this group. And, I sort of connected the dots. I'm like, oh my gosh, this is what I had. And back in the 80s, that was not it was far less known than it is now. So we could spend hours talking about selective mutism. The thing that I didn't have personal experience with was misophonia until I had personal experience with misophonia around 2018, 2019. I started developing misophonia related to the sound of my wife flossing her teeth.
Interesting.